All right. Hello, everyone. Welcome to the What's True Health podcast. Today, I'm joined by Andrew, and we are going to be talking about beliefs and whether we should challenge beliefs in a bunch of different contexts.
Yeah.
And Andrew hasn't been on the podcast for a while. We haven't been doing the podcast for a while. So I think you've got a few new qualifications now that we might want to put in there just to establish that authority. You're an authority figure. So
Sure, if you want to call it that. I'm trying to remember. Apologies. There we go. Um, Last time I was on here, I think I would have probably been doing my honors, started my honors year
mm,
maybe.
yeah.
Yeah. So now that's done and published, which is excellent. So um, I'm now doing my PhD. I mean, I've just finished my first year of my PhD actually, officially on holidays now, which is great for a few weeks over Christmas. And that PhD is in a different area to what my honors was in. So my honors was in exercise beliefs and perceptions while experiencing chronic low back pain. I'm still in chronic pain, but more in health, disease, chronically, more generally. So I'm looking more at the link between lack of physical activity or physical inactivity and uh, chronic health diseases, cardiometabolic diseases, more specifically, um, as a result of inactivity because of people's chronic pain and being afraid to exercise and blah, blah, blah. Um, yeah, I'm having a lot of fun doing the PhD. Lots of ups and downs so far. It's very different to undergrad life, like very different to even an honors year, even though it's still just research. But yeah, I'm very much on the research train now, which I'm loving.
Oh yeah. And hopefully one day I could join you on that train.
Oh, that would be awesome,
That
dude,
would be
because
amazing.
you're very much that way minded, you know? So, like, to see you in the same position is, I mean, it's like fulfilling a prophecy at this stage, honestly.
Well, only time will tell. I just need to get good enough marks for now.
Every a lot of people do say that, man, but I don't know what it's like at UCID now that you're there, but I mean, I could have gotten into this PhD with second class honors, which is 75, you know. Um,
Really?
Yeah, yeah. Like there's a lot of other avenues that people don't know about. I mean, the easiest way is to get first class and then you're a shoe in. But I mean, I've done everything the hard way, so I know all the options, you know.
Is it just because the demand isn't there for research?
Well, in my area at least, in health sciences, there isn't too much of a competition to get scholarships.
Hmm.
So like you can get accepted into an honors with just a 65, so a credit average, and then that goes up to 75. Known as honors second class, like one, just 2.1, 2.2. Um, as long as you set up yourself by talking to possible supervisors in your area and having an idea and everything, you're going to be okay. And you're probably going to be able to start your PhD with less than an 85 average.
Damn, it's pretty
Yeah.
good. There's some motivational words.
Yeah, I mean, like, it's that, but I think people worry a lot because, for instance, like psychology, there's like thousands of people going for honors and masters, and like 20 people get in every year, so that's a different ball game.
Oh, I don't know about that. Like the demand and like supply and demand for different research in different degrees.
Yeah, yeah. I mean, it's very specific to supply demand a lot of the time, especially when it comes to stipends, what do you want to call it? When money's involved, they've got to distribute it somehow. And like, for instance, WSU does it differently to UNSW, right? So, and then even in between that, faculty to faculty will do it differently as well.
Oh
So
wow.
you just got to have a look at where you're going and be specific to that. Yeah,
Oh, okay, there you go. I just learned something. There's an
yeah.
insight into getting into the PhD.
Yeah, I think we've spoken about it before that there's like a lot of politics involved with getting a PhD as well. It's not just
Mm.
research, you got to go to meetings, you got to go to conferences, you got to know what journals to put things in, and stuff like that.
Imagine.
There's more to it. Yeah.
Cool. We're getting a bit carried away, but
Mm.
the main thing we want to talk about today is um challenging beliefs. When do we challenge them? Do we even challenge them? And what contexts is it okay to challenge or not okay to challenge? And the reason this came up and the reason we're doing this podcast today is because um, I had an encounter where someone was buying the spiky balls?
Yep. The massage
Yeah,
spiky balls. Yep.
massage spiky balls. And I was like, oh, why did you buy this? And they were telling me, oh, because I'm going to release my fascia, right? That's a classic trope.
Yep.
And I didn't really know because I've had lots of different experiences in the past. At that point, I was just like, oh, okay, cool. Like I was kind of went along with it. But then afterwards, in my head, I was just like, oh, should I have said something? Should I have not? I don't want to make it awkward. Like all these questions kept coming up. And that was in the context of like a friend. And yeah, it's just very confusing. Do we do it? Do we not do it? Um, yeah, so I kind of just want to talk about that. And I think it's something that maybe is not touched on as much. I don't know, in your experience, if people have talked much about it.
I mean, the topic in itself being spoken about, maybe not, but I mean, it's everywhere in our lives as humans, right? We want to challenge people, we want to be right rather than be wrong, things like that. Um, I think overall, my stance on challenging people has changed a lot. I was definitely, and I do cringe at myself a little bit from, 3 or 4 years ago, challenging all, yeah, I still would call it pseudoscience, but I would approach it differently now. Um, I'm okay with letting things slide if nobody is directly harmed in that moment. You know, um, if it's not my client and nobody is getting harmed, like in that moment, yes, there's always carry through harm, or if they don't do something, they could do something in the future based on, whatever. But it's not like I'm saying don't eat vegetables because they're going to kill you. That's harmful.
Yeah.
As opposed to have a massage, it's like, it's not going to do you much, but it's not harmful. So I
Mm.
stay quiet on those things simply because, well, I do have other things to worry about now, which is getting better information out there, rather than having a lot of little talks with one or two people at a time. You know what I mean?
Yeah.
So, like, my views change as a result of that, which is funny because past me would probably look at me now and be like, well, how could you say that? That's unethical in a way, and all these different things. And it's just different perspective now. Like, I mean, did you want to speak up in that moment, Victor? Like,
No, I had a similar journey to you. I was just thinking like last year, I definitely would have said something, but now it's gotten to the point of like, no, it wasn't from the point of view how you're saying like it's not harmful to them. It was just kind of I gave up. Like, there's no
yeah,
point. I haven't had much success with it, so I was just
yeah,
like, whatever. But I've had sort of a similar journey to you, and like last year, I really would have been hammering down, and I've done that a few times. Sometimes it's gone okay, sometimes not. But yeah, like this year I've kind of just given up, to be honest. So now I'm just wondering for next year, 2025 is coming up, what should I do? Um,
it's a good
and
question.
I think we're taught what you mentioned something really good there, like the difference between saying something harmful or like advising someone to do something that would be harmful versus something that won't harm them or like would have a placebo effect.
Yeah,
And I think we're going to focus more on that second part with the plus like no effect to placebo effect area because I think we can all agree if something harmful is being said, we could just say, no, that's not true. Um, yeah, I just feel like
yeah,
we encounter more of the placebo-y and like wrong train of thought, wrong model kind of conversations. That's what I
yeah,
kind of want to focus on.
yeah. No, for sure. Uh, it happens to me a lot where people, rightfully so, will say something that is pretty much correct without realizing that. I'm going to use an example from the other day, actually. One of my friends was talking about SMART goals and how they're not really that great, and there's other ways to do things, and blah, blah, blah. And I said, okay, cool. So what do we do instead? Because I know for a fact that in the trial that I'm helping run, we're using SMART goals. Is that a bad thing? No. Is it a good thing? Eh, I mean, we could use something different because it's about how you implement it, right? There's no harm in using it if you know the underlying theory behind it, right?
Mm.
So I'm trying to get myself back on track here now. So like if you have um, something like I keep using the SMART goal example, which isn't shown to be any benefit over something else, and you call it bad, that's sometimes a problem because then we can move away from it. When it's like, well, it has the same effect though, right? Why is it bad in your mind and in what context? You know, those are the questions you've got to ask, or what makes it bad and things like that. Because, I mean, yeah, like SMART goal, that heuristic is kind of crappy when you implement it with people, but so can open goals or value-based goals and things like that. And I'm yapping on about goals because I'm currently doing goal setting stuff for my PhD. But you know, it all comes out with the same kind of effects. It's about how you implement it. So that spiky ball example again, right? Yeah, it's probably not going to do the thing that they're saying it will, like release fascia or whatever it was. But that's okay. Like they're still probably going to get an outcome that they want, right? And I don't know if that tangent kind of answered it, but yeah, that
No, yeah, yeah.
placebo, yeah,
Um, just another tangent. What's the
yeah,
critique with SMART goals? Were there studies that looked at SMART goals versus other goals and they found that
yeah.
it wasn't like for behavior change? Was that a thing?
I mean, ultimately, SMART goals, you know, specific, measurable, achievable, realistic, time-bound. Like a lot of those, the initialization, the acronym of it, it overlaps a lot in itself, and it's like we can't really like once you do specific, right? It usually makes it measurable if you haven't used numbers already, and you know if it's realistic, cool. But did I skip one there? Yeah, achievable and realistic, they're very similar. And it's kind of like to operationalize it, it's almost silly in the way they've written it out. And I've heard people do like Smarties and things like that. There's another one called Maps, all of that. And it doesn't matter about that acronym, right? It matters how you implement the theory behind it, which is the behavior change theory, right? So that SMART acronym doesn't actually come from anything scientific. Somebody was like, this sounds good and it works well. So they used it, right? Um, and, you know, there's value-based goals, which are very similar to open goals a lot of the time as well. So open goals, you know, there's no doesn't have to be like a time bound thing or there doesn't have to be like an end point. It's just how much can you get done? You know, whether it's a amount of time or how long will it take you to get to this number. So, you know, that moves away from the SMART acronym and keeps everything open. But they don't do better than each other because like there's a challenge aspect to it. If something's more challenging, people are likely to do more. But if it's challenging, they're also not likely to get to their goal, which can be demotivating. And there's so much more about it, right?
Hmm.
So there's critiques to every style, and Smart Goal just has some pitfalls to it.
So it sounds like the whatever acronym you use like isn't as important as like the implementation within like a whatever model you're trying to use to encourage
Yeah,
behavior change or goal setting.
exactly.
Okay. Okay, that makes sense.
Yeah, because then you also got to think, well, we could use that Smart Goal heuristic, but then what if I just set your goal for you? Is that helpful? Like, you know,
Yeah.
um, or then what if I just say, hey, set a goal? Is that helpful? Because you don't know what the hell to do. Like, you know, so it's all about how you do that. Yeah.
Oh, there's a lot about goal setting. I got to talk to you about that. Damn.
Oh, I mean,
Okay.
I've been looking at it for the last 12 months, man.
Yeah.
So,
I didn't know there were that many types of goals, and now you got me thinking of like the patient interaction. Okay, anyway,
oh
um,
yeah,
that's
welcome to my
crazy.
thesis.
But okay, let's start off with in a like a clinical setting with a patient.
mm,
And they give a quote unquote wrong, incorrect, false belief.
yeah,
You've probably experienced this because you've been working for what, like a few years now? Just been a few years, 1 or 2.
2 years now. Yeah.
Yeah, yeah. Um, Surely you've heard some stories of things like this, and how did you approach? Maybe we can go like, how did you approach them?
Okay.
And then reflecting, what could you have done better or worse?
A really good one just came to me. So one of the clients. Also, can you hear any background noise?
Yeah, yeah, but it's fun.
Okay, cool.
Yeah.
So one of my clients at the time had come across like a legitimate paper on swearing and working out. Um, yeah, and they were like, well, the paper said that if you swear, it helps you work out and push harder and stuff. And it's funny because if you look at that pragmatically of like how that works in a clinic, because we were in a group setting at the time, and there was three other people in the room with us, and all under me at the time. And I said, that does make a lot of sense. And I had read that paper, it makes a lot of sense just behavior wise. Like if you're swearing, you're blowing off that steam. You're more likely to push harder. If you're same with screaming or listening to loud music, right? The stimulus, right? And I could have sat there and explained to her why that might not work all the time or something like that. But instead, I went the pragmatic route and I said, all right, what swears do you want to do? And she goes, oh, well, like, I don't want to just like swear now. I was like, okay, so like, you don't want to use that tactic then? She goes, no, but I just thought it was interesting. I was like, okay, cool. And then that was it. Right? So it's like, she wasn't right, but she wasn't wrong. And then I tried to implement it with her and it didn't fit the context. And that's how I got around that. Right? Now, I could have gone, another route and been like, oh, that's interesting because, if we look at the inverted view of arousal, if you swear too much or do too much stimulus in one go, it might not be helpful. It's like, but does she need to know that?
Yeah, and it comes off as like lectury, and
Yeah, exactly.
then I've definitely had that, and doesn't really work. Um,
Yeah,
because I think they're coming from it from the approach of like this was interesting rather than like I want to know if this works. Very rare
yeah,
do people come with the intention of like tell me if this works. Like it's more like they believe it. They just want like confirmation or like validation that like yeah, that'll be cool to do if you swore. Um, yeah, that's a good one because it's not harming, but then you can also see the benefit of like if they did do swearing, that could add a bit of fun to the group workout or whatever. Like, and it's like
yeah.
nothing, but then the belief system is always there. But yeah, again, it's just so tricky.
Yeah, it's a very simple, like, weird one that doesn't have too much like harm involved per se,
Mm.
as opposed to like believing that you're, shifting bones when you're not and things like
Yeah,
that.
yeah, yeah.
Um, but it's just a funny example that came to my mind, and that's often how I deal with things. I just ask them if they want to implement that stuff that they're talking about and what they think about that.
I think that's a good approach for like the swearing one, where it's just like if you swear or don't swear, like nothing's really gonna change. Like, and yeah, you're right. If you have the belief of like swearing will increase your reps, like that's not really harming, even in the long term. Like, who cares, right? Just something fun. That's a really good way of approaching that. So maybe in that context, I think we'd both agree on like the whatever, like we won't touch it or like we'll implement it. We won't challenge it. But then you mentioned about like bone shifting and that book you gave me, Surgery, the Ultimate Placebo.
Yeah, it's a good one.
I'm thinking about that because he said something about spinal fusion surgery
Hmm.
and how it's not as effective as a placebo. I'm pretty sure that's the argument. I could be wrong about that, but the fact that it's in that book means like maybe it's not as effective as people might think. And I remember him talking about Was the author Ian Harris?
Yeah.
Yeah. I remember him talking about some patient who like started off with those beliefs of like my spine shifting and stuff like that, and then they gradually went down the path of surgery and spinal surgery, and they got spinal fusion when, for example, exercise might have been more appropriate. I can see how that probably happened lots of times. What do you do in that context? What would you do?
I mean, in that context, I would follow the current guidelines that we have, which is to put surgery as the last intervention. Sorry, after you have trialed non-invasive interventions. So exercise for like back pain, if we're talking about that, is the first line treatment. You should be doing physical activity. And if somebody's talking about surgery before they've even tried to walk, in some consistent routine, like just as simple as that, I would be telling them you are doing yourself harm. Because not only are they going to have to recover from the surgery, have the effects of anesthesia on them, which can be harmful. You're told this before you go into surgery. Obviously, you have to go under to go into surgery, but there's always risks of that and infections as well. If it's like fusion or if anything's put on the bone itself, there's always migration that can happen, and you can have resurgery. So you have to like redo a surgery some of the time, especially for like neuromodulatory surgeries. Like they fail a lot. Um, there's
Money.
actually, yeah. But
Yeah, like the money as well of all.
money was the next one I was gonna say. Like there's all of that. Like, and then anyway, you have to do the 12 weeks of rehab after that
Mhm.
anyway. So like, just
Yeah.
do it beforehand. Like,
Yeah.
you know.
Okay, so then what if because I'm not sure, but I could imagine someone who's about to get the surgery, like usually the people who get the surgery, they've been having, let's say, back pain ongoing for months, years. It's like really getting bad. Nothing's helping. And let's say they have the belief of their bones are out of alignment, things like this. That might push them towards that surgery option where it might not be as helpful or like in their best interest.
Yep. I guess at that point, it's evaluating what have they done, what haven't they done. Because it's not to say that surgery is not a good option. It very well can be. Not for the reasons we think it is a good
Mhm.
option, though. Hence the book, Surgery, the Ultimate Placebo. Um, but if somebody believes they're going to get better, it's likely that they are, right? So they believe that surgery is a good option for them and they've tried other things and, they've got good healthcare cover and all that and it doesn't cost them too much. I wouldn't deter them from getting an opinion of a surgeon, um, especially if nothing's getting better over the course of, 3 or more months. Um, if there's no improvement, then I'd be like, okay, there's a chance that surgery might be helpful for you. But I would let them know everything about their condition and matter of factly lay it out to them, be like, but you haven't done this, you haven't done that, or we haven't tried this, we haven't tried that, I should say more like it. Um, because ultimately we can't stop them from getting surgery, and we also can't say that surgery is a bad option either. We just got to tell them the risks, like I just listed before.
Mhm. And with the thing about that as well is that if you did address the beliefs of let's say your spine is moving, you got to like get surgery to fix it in place. That could actually, if you address that, that could actually reduce the placebo effect in the
Yeah,
surgery.
yeah,
So in a
100%.
way, you're kind of harming them.
I like that. So it's funny because you could say I'm harming them by telling them that truth in quotation marks.
Yeah,
But also, maybe we could argue that I'm helping them because I'm shifting their perspective to then have a better effect for exercise.
yeah, okay, okay.
So, do you know what I mean? So,
Yeah,
if they go and get the surgery, yeah, we could argue that. but we can only argue that theoretically. We don't know because we can't measure it, you know?
Mhm.
Um, which is, yeah, that's a good argument. I like that. It's quite
Yeah,
meta.
that's like the whole placebo rabbit hole. Yeah.
Yeah, exactly. Um,
Okay, so that's like more end, like last line of defense surgery end game sort of thing. What about like at the start, someone comes in with, I'm just gonna use back pain because it's the most common one.
yeah,
And again, they're thinking like this, my multifidus is too tight or something like that.
yeah,
I've got I might have a disc bulge, stuff like this. Um, or like even they've got like they had an X-ray and it shows like degeneration or something like that. Uh, would you address? I've heard mixed things about this, but would you address it at the start? Because it's also really important of like building rapport and stuff like that. I don't know how I would even
yeah. I
do.
think you can do both, two birds, one stone. You can build rapport while addressing it. Um, a lot of the time, the last thing you want to do is genuinely challenge what they've said straight up. You want to first begin a small bout of like education around pain because learning about pain is a treatment in itself, right? There's an effect there. It's small, but there's an effect, which then carries on if you add exercise to it, right? So if somebody comes to me with that multifidus kind of belief, I know it's not true. I know that from the research, but they have a different experience, and that matters, right? Because what else we know from the research is, well, if they believe that to be so, then their pain will probably stick around. So I would normally play into that belief. And that sounds a bit unethical, but I'll explain myself a bit more. So I will ask, okay, cool, the multifidus is tight. Tell me how you know that it's tight. Let's look into that. And I might even do some like functional tests with them. Look, ultimately, the functional tests aren't looking at multifidus, but if they think it is, excellent, right? Because they see that as getting help. And then while doing that, I can start talking to them about chronic pain and be like, when this lasts for this long, our pain system starts doing X, Y, Z. And when we have these feelings here, as opposed to pain, like sensations, and I start using different wording and I'm helping them feel comfortable and relaxed while teaching them about their own pain, without challenging them.
So you're buying them in at the start.
Yeah, you could call it that, buying them in, because ultimately what I think and what the research says doesn't matter. What they think is what matters.
Mhm.
You know?
So so someone comes in with that kind of belief, you sort of like play into it and build that rapport and they trust you and you so you even mentioned doing like functional exercises which aren't as like the idea behind that being like just to not trick them but to make them believe that they're getting something of value. Is that it?
Yeah, yeah.
Okay.
Well, it's not even tricking. They are getting us something of value because they believe it.
Yeah,
You know,
yeah.
it's all about their beliefs. I see it as non-valuable. So if my clinician did it, I'd be like, bro, what are you wasting your time with? Can we get to squatting, right? So um, it, it it's valuable to them because they believe it is, and that's valuable to me, right? So um, that's going to help them stick around and keep doing the things that I know are helpful, which is moving, believing different things about their pain, learning new things about their pain, and so on.
Oh, interesting. Okay, so you're buying them in, even so you're using valuable clinic time even just to do those a few functional exercises just to get them to buy in, and from there you sort of flip a switch. It sounds like where you're now talking more about like once you're actually getting started into the program or whatever you've developed, you start talking about things in a different way.
Yeah,
Is
yeah.
that right?
So I wouldn't like it's always like got an educational underpinning to it, but it's got to be to their level and meeting them where they're at. So I had a client for a long while that basically just didn't do what he said he would and what he said he wanted to do even. And it wasn't until I realized, okay, there's like another layer here of what he actually wants, which was, to see pretty instant results. So I gave him those instant results, um, which was just him understanding that he could do something differently. So I did like a movement experiment where I asked him to get up in a different way than he normally would. And then I just said, hey, did you notice you got up differently with your left leg than your right leg? He goes, yeah, it felt different. And we just spoke about that. Then we made it a game. Then that incorporated his son into it, which is really what he wanted to do, was play with his son a lot more easily. And that brought value straight away. And that to him was like a change that was important. So that's what I wanted to give to him, even though it meant nothing in the session. I knew that it was going to de-stress him, which means something in the long run.
Actually haven't thought about anything like that. So, because just in my head, it's just like you got to use the clinic time to do as much as you can. We didn't have much time, right? Like, because what's like half an hour sessions sometimes, or even less. But then sometimes you can throw something that is not conventionally valuable, like in the textbooks, but like it's valuable to them, and that might still help.
Yeah, dude, it's a foundation, right? You need it every time. So, I mean, I take my my mentoring in a way comes a lot from my sister, from her psychology, where she's even said to me, like, look, sometimes I get 45 minutes into a session and then the real issues come out and we've got 5 minutes left. And she's like, okay, well, I can't do anything now because there is a time limit. I've got another client, but I can plant a seed or give some little bit of homework for next time to set it up. And that's basically what you're doing. You know, when you paint a wall, you put a base coat on, right? You don't see the base coat after, but it's important that it's there because it has
Yeah.
carry on effects. Let's think of it like that. You know what I mean? So I would still say it's you're still using your clinic time pretty well.
Mhm.
Yeah.
And when you are planting a seed, just back to the multifidus example,
Mm.
would you explicitly say, like, at one point, would you just be like, I don't know how to word it. I'm really struggle with the wording because you want to get to the point, but you can't just say, oh, what you thought is actually not true. Like,
Yeah.
this is actually what might is more likely to be happening. Like, the wording is really difficult for me.
So what I've slowly learned over time with my own, um, yeah, I don't like using these terms, but like the more difficult clients, right? Um, is, for lack of better words, is that it doesn't matter the 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 kind of path you took as long as somebody gets there, right? So a lot of the time it's me being quiet when there's kind of crappy information coming from my client themselves, because then it forces them to reflect on their own thoughts that they've just said, and then I don't even have to challenge at all. Um, but there are times when I see people doing too much, and I say to them, you know, what might be a good idea is if we just take our foot off the gas for a moment and focus on X, Y, Z instead of A, B, C. What do you think about that? Just things like that, like putting it to them as like, hey, this might be a good option. What do you reckon? Things like that. It's not like saying that's not going to be helpful for you. Don't do that. That's like accusing them of doing something bad, which isn't going to help you build rapport.
So rather than accusing them of doing something bad, you're like rather pushing them towards a more valuable belief system.
Yeah, I guess it's valuable in my mind, based off what
Yeah.
I know. So it's got to be valuable to them in some way, which is me. Once I've said it, I got to check in with them. Like, do you see that as valuable?
Mm-hmm. So, okay, cool.
Yeah,
So you're not getting rid of the original belief totally. It's just like you're giving them a new perspective.
yeah. I never
Belief can
try
still stay
to.
there. Okay.
Yeah, I'd never try to say that their belief is wrong or bad. I would always just give them a new idea, and if they want to adopt it, they adopt it. It's got to be up to them. There are some people that like more autocratic kind of style where I'm just like, nah, this is what we're doing. But to get there, you need to know your client well in the first place. You know, it's not something you do from the get-go.
So what I'm imagining here is back to the spiky ball example. If someone said, "Oh, I'm using it to release fascia," I could say something like, "Oh yeah, that's cool." But also like when I do it, it feels good as well, and that also I find that helps me. Like so something like that. So then
Yeah,
I'm not,
yeah,
yeah,
yeah. I would say that's a pretty good way to do it. So, you're not saying that they're right or wrong. You're saying, yeah, and it just feels so good, doesn't it?
yeah, and yeah. That's actually
Uh,
really good.
yeah. Because then it's like, I wonder what else you could do that also feels really good that you could add to that. Have you tried doing this exercise, this stretch? Like one that you know is
Mhm.
going to have an actual effect um, with a different narrative into it. Because then if they go, oh, but does that stretch release fascia? You can be like, it doesn't, but you know what it does do? Blah, 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 you know?
Yeah. I like that approach because it's kind of the best of both worlds. You're
Yep.
not you're not you're just giving them a new bubble to think about rather than just popping the original bubble or like
Yeah, I like
if
that metaphor.
that's cool. That's really cool. Where did you find that from? Or was it just exp over time you sort of developed that?
Um, Honestly, I think it's looking at my own supervisors dealing with me through my PhD. Because I'll come to a conclusion and then come to them and be like, yeah, that's kind of what you were getting at like a month ago, wasn't it? And they're like, yeah. So um, people need to get there on their own, you know?
Mhm.
Um, I think there are times to pop the bubble, and it's when they are in danger.
Yeah, yeah.
you know? Like another really simple thing, if I saw my client with a shoulder halfway off the bench, right? I could just be like, oh, they'll self-adjust, what's that one? The dynamic systems theory, whatever, right? Um, but let's say they don't, and I'll be like, hey, man, you might hurt yourself and slip off the bench if you don't put that shoulder back on. Can we pop it back on? That's okay to do. like, things like that. And I will teach technique and I will tell people, hey, they can get more out of it if we do it this way. But I only say those things if it works them towards their goals.
Mhm, mhm.
Yeah.
Awesome. That was really good. I like that. Okay, so that's patience.
Yeah.
Now let's move on to colleagues.
Yeah.
Um,
I think that's harder.
so, and then like there's some points we can talk about. It's like because it's an employee, we can go like colleagues, but also like bosses. Then you risk losing your job or having bad relationships with
Yep.
people at work. How do you tackle that? You probably have more experience about that than me.
Yeah. I am one to have not too many conversations with like other colleagues or bosses straight up because it's not their beliefs that matter, it's the client's beliefs, right? So, yes, they have influence on the clients, 100% they do. And there are times when I've shared a client with a colleague or, a boss, and it's unfortunately like they've come to my next session and my foundational work has been undone. The thing is, though, I use that as like a teaching point for myself to be like, okay, so why is it that they picked up on this belief so much quicker from my colleague than my ones that I was working with on them for them? And a lot of the time it's like, well, because what I was teaching them was against their belief system. So why not go with their belief system? So that's kind of where I've learned a lot of that as well. Um, I would say like if I'm putting in my notes that the rest of the team can see, and they've gone against my notes, I'd be like, hey, just so you know, can you check my notes for next time, please? Things like that, because then that's just a bit of lack of, I don't know if I call it unprofessional, but they haven't done their due diligence to check notes beforehand. Do you know what I mean?
Yeah, yeah.
Yeah.
Okay, cool. I want to give an example. Let's say you're working in a clinic and then the owner of the clinic puts like a poster or does an advertisement for social media where there are inherent implied assumptions in that ad or poster that aren't up to date or a bit outdated. Would you, because that's then you're showing the public and possible clients like you're already setting the foundation there with not so helpful uh like assumptions about the body, how it works, stuff like that. What would you do in that situation? Would you even
Leaving
do
it,
anything?
I would honestly leave it again. Um, there's an easy option, which is if that happens all the time, leave, right? But that's easy. People don't have the money to leave. People don't have the resources to just leave a job, right? I mean, I'm lucky that I do, so I can do that, and I have done that. But um, I would personally leave it because once they're in the room with me, it's going to be different, right? And if they then say, "Oh, but the poster outside," I'll be like, you know what? Poster outside does say that. Let's talk about it. So stuff like that, because ultimately it's my boss's or colleagues' fault for not being more up to date, right? And if it starts being a problem with clients themselves, it's the clients that actually need to either maybe say something or um, mm, maybe I take that back. Not say something, but hmm.
It's tough because if they do say something, it's like, oh, who told you this? And then,
Yeah. Well, I would happily say I told them that because of XYZ. Like definitely, because again, it's to their situation, right? Because again, what if even though the poster isn't exactly up to date, it's still helpful for somebody and helps them seek care? Do you know what I mean?
mm.
There's so many things that I thought to be unethical or not up to date before, but then I realized, yeah, but it's still very helpful for people.
Hmm.
So, there's a lot of that. Like, there's a lot of different ways to approach things, and um, like, unless it's saying like, don't work out if you're pregnant, stuff like that. It's
Yeah,
like, well, that's obviously harmful. No,
yeah.
people can work out and should. Um, there are things that shouldn't be put up that are like if somebody says like let's release your fascia, I would be like, look, we're not releasing fascia, you know.
Mm.
And I would say that to my boss because that's just a matter of fact now. But if it's something, simple like, oh, mechanical back pain, it's just like a poorly classified, you know, version of back pain. I think all classifications are pretty poor, really. So like, and we've gone from non-specific to primary and secondary pain and things like that. It's like, what do those words even mean? And that's neither here nor there for me.
All right, cool. And then we can get to that. That kind of opens up the discussion for like ethical marketing and stuff, which I
Oh
don't know much
yeah.
about, but like that could be a whole different discussion. So I think we'll leave that there. That was pretty good.
Hmm.
But that one seems a bit more iffy. Like tread a little bit more carefully in those situations, unless it's directly harmful.
I mean, I take probably a very different approach to what a lot of people would. I come from a very kind of like, I do not care as long as the person in front of me is getting to where they want to be, kind of approach. Because at the end of the day, if I worry too much, I burn out, right?
Mm. Yeah.
I'm only one person, and I'd rather help the client than try and change a whole clinic, you
Yeah.
know?
Yeah.
Yeah.
I didn't even think about that. Yeah, because if you've got other things going on as well in your own life, like,
hmm
yeah, interesting. Okay.
I think, yeah, that's one big thing I've learned doing a PhD. It's like I'm doing so much just reading and everything that like any client facing work I do, like I don't think about it once it's over. It's done, you know, because it's not my main gig and I got other things to go to, other people to talk to, and yeah, I'd
Yeah,
imagine a lot of people feel that way as well. So
I can imagine. Sounds quite stressful.
yeah, it can be, man.
Um, moving on to placement now, just very quickly.
Yeah.
Have you? I feel like I'm gonna be so screwed second year for placement because if I don't control myself
Mm.
and I don't control where I'm going, they're just gonna put me somewhere. I feel like I might not um be the best student for them because like I'd probably be like challenging, questioning a lot of their things. But now since I'll take a different approach now after this discussion. But it just adds a new dimension because marks now, they're the one giving you the marks.
Yep.
And if you do something horribly wrong, you could even like they could kick you out or you have to repeat the subject, things like that. So
Hmm.
I've talked to Dan about this, and previously he's told me like just get the degree, like get the piece of paper, which is one approach. Um, what do you think?
I think there's some truth in that advice. It's a decent advice of just get the paper because a lot of people just want to get through it and then act more authentically themselves once that's over. Personally, that's not how I like to live my life. I want to authentically be me whenever I can. Um, yeah, I'm very neurodivergent. I don't like masking. I don't like any of that. Didn't help me. I masked all the way through my own placement. It did not help me, right? So that's me looking back. If I give advice, is be yourself, but be curious and don't be combative. Don't try and be right. Try and learn. That is definitely it. So even if you know you are right, like that's something so simple, like I'm gonna put your SIJ back into place, right? Because you're now doing physio, right? So you're gonna come up against that stuff, whereas I didn't as an ex-phys. Um, you can probably just ask, why are we doing this? Or how come it's the SIJ that we have to put into place? Things like that, right?
Mm.
And aim to have a conversation that you can learn from. So if you're not coming to the conversation to gain knowledge, then don't have it.
Yeah, okay. Because it gets very emotive
Yeah.
when that happens, and it's like, oh, for some reason, I don't know why, it just like bubbles up. So yeah, you're
Oh,
right.
yeah.
Coming up from a curiosity perspective rather than like entitlement, I guess you could call it, of like, I'm definitely right. I need everyone to know I'm right. That would help.
Hmm. And um, all of this comes from me being wrong every day. I will go into supervision meetings sometimes, and one of my four supervisors, who are all postdocs, freaking professors, highest in academia you can get to, they will say to my face, like, no, we can't do that. And then I'll be like, I've just been looking at this all week and you're telling me no? Like, how can I be wrong? But I sit there and I listen, and at the end of the hour, I understand why they've said we can't do that, right? And it
Mhm.
doesn't matter. All the emotions came to me, and I wanted to be like, but this, that. Instead, I sit there and I say, okay, what do you mean by this? And how come this? And why not that? And things like that. Actually, I would encourage you to even stay away from why questions because they can seem combative as well. Just like, oh, why, what, and how, you know,
What?
like, yeah,
Okay. How do we know? How do we know that the SIJ is moving when we're doing this manipulation?
yeah. Or even make it personal. How do you decipher that you've even moved it? Because I can't do it when I'm in class. Can you help me?
Hmm.
Stuff like that.
What do you think about this? Like, oh, that's really interesting because I've read a paper that is kind of talking about something different about this topic. And like you would show it to them and be like, have you looked at this one? Like, is it all right? Maybe after you're done or have free time, we can look over it and see. Because I just want to know. I don't know if I'd say who's right. I just want to know what to do or something like that. Do you think
Yeah,
that's all right?
yeah, yeah. And you'll find the wording, like, you'll find nicer wording along the way. It's like just then, instead of saying knowing what to do, I would have said, I want to know where the right place to implement this is.
Yeah.
You know?
That's smooth right there.
Yeah, you just learn these things. I mean, I've been at this game in uni for 7 years now, so like, you get there. Don't worry. I'm 27, man, so things take time. Um,
And
but
then
like, yeah.
let's say you show them the paper because I've had a sort of similar experience when I've done like talking to other health professionals, they would be like, "Oh, don't worry about that paper," or stuff like that, which
Yep.
is like alarm bells, right?
Yep.
Um, at that point, do you just go back to like if you know this person, I was gonna say sucks, but if this person just isn't up to date, isn't the most, is like not a good mentor, you know they're not a good mentor. Is it okay to just like whatever, this placement's just for 2 more weeks, I'll just grind it through?
Of course it's okay because you're already there, you know. If you've made that assessment, and even if they're a great mentor and you just don't vibe with them, you can
Mm.
still make that assessment, right? Um, you, you just stick it out and finish it up, you know?
But there's a
Um,
spectrum of
yeah,
people who aren't valuable mentors in the clinic, people who they're really open to discussion, like you could talk to them, you could even use combative words, they don't mind, stuff like that. But then people in the middle where it's kind of iffy, but you can still do it. Maybe you could challenge beliefs there more and they'll be okay. You would actually learn a lot. But maybe
yeah.
for that like other end of the spectrum where it's just like, no, I'm the authority, this is what's right, like just be submissive at that point.
Um, you could go that submissive route, right? You could also kind of take it in your stride and be assertive and say, where did you find this out from? And then all of a sudden you've got a new resource. And because you've got a different lens, you can use that resource differently to them. Yeah, so you got an opportunity to learn for yourself, even though you've deciphered that they're a poor mentor.
Okay, cool.
Yeah.
That makes sense. So use it as like a springboard for further discussion.
Yeah, like there's always something to get out of it, right? You're in placement, make the most of it. I mean, when I was in placement, being candid, I was depressed as anything, right? So I was just trying to get through it. But at the same time, I learned so much, even from, a placement where I really didn't think I was going to learn much at all, and I still don't really like the company, to be completely honest. But I was there going like, this is interesting the way they do things, and I understand why they do it this way. I wouldn't, but I understand why now, and it gave me just another piece of the puzzle,
Mm,
you
at
know?
least you learned something, right?
Yeah,
Yeah,
exactly.
yeah,
Yeah. And
yeah.
believe it or not, I made some connections through that as well. You know, that's another big thing is
Mm,
meet people, talk to people, clients, whatever. If you're in a gym, you know, the other gym members, things like that. Just make the most of it.
that's okay. That's a good point. Yeah, because you might not be learning how to be the best health professional you could be, but rather you can learn about like I don't know how how to make a really profitable business or like making connections, like you said. Okay, so you
Yeah.
just change those avenues.
Yeah,
Um,
dude, you gotta change your lens a little bit.
that's a good point. Finally, let's talk about just the public
Yeah.
in general. And then we can go like strangers and then friends and then family. Family and friends kind of different, but now I think we can make them a bit separate. So let's go strangers, complete strangers, family and friends. So let's just start with strangers.
Hmm.
Um, do you think I've always felt this sort of need to like educate or like inform people about the things I've learned because I find them super interesting. Like I feel like I've got a duty as like a healthcare professional that like, helps people to like inform them of these kinds of things. Do you think this is just some sort of fabrication in my head, or do you think we should actually um, do it or not? Because you had a different take from me from our discussion before.
Um, yeah, so I would say that for strangers, they're the ones you can just leave alone and walk away from. Um, it's whether or not you want to, I'm going to use the word stress, but introduce stress into your life. Because if they disagree with you and you have like a back and forth, how is that valuable to you is what you got to ask, right? What is your goal here? Yes, you did mention that you got like a kind of duty of care as a healthcare clinician. I don't believe that you do. No one's paying you for your time at the moment. Go and enjoy your day, right? Um, so it, but at the same time, if somebody's directly talking to you in public, have a chat, sure, but also understand that you can assertively say, "I've had enough now. I'm gonna go." You know?
Okay, so you'll take the approach of strangers like, who cares, don't waste your time sort of thing. Um,
Yeah,
yeah,
pretty
but I
much.
see it a bit differently from the lens of like I'm serving the community in a way. Like whether or not I'm getting paid or not. That's just how I see it of like,
Yeah.
yeah, it's just maybe my context. It's just like I need to help the people in my area, like number one, promote physical activity.
Mm,
Number two, like because that's kind of the roles of health professionals, like and it like
yeah.
healthcare expenditure. We're trying to prevent a lot of diseases, stuff like that.
That's a great point, the healthcare expenditure as well, because like, oh, maybe I'm perpetuating a poor healthcare system by letting this slide.
Yeah,
Um, and I think my argument before was, well, if you see somebody putting the wrong thing in the recycling bin or something, do you go up and tell them, or do you let it slide? If you see somebody wasting water, do you go tell them or do you let it slide? At what point, you got to choose a point where of things you care and don't care about. And if you ethically or like just morally within yourself care about telling people what is like the correct information, I think you can do that. It's just not a decision that I would do for strangers, let alone actually less so, I would say, for my family.
I'm still trying to wrap my head around that recycling thing because that's a really good point because no one really like, or if unless you're an environmentalist, right? That's like completely different because they might they might talk to you about that.
So, like, my question is, why aren't we talking about veganism right now?
What I would say to that is, okay, so we have a community, right, of
Yep.
Sydney, and we've got the physios, exercise physiologists, all the healthcare professionals, nurses, right, whatever. We're trying to promote physical activity, trying to promote a healthy lifestyle, all these things. That's our role.
Yeah.
Okay. The nutritionists, they're trying to promote a healthy diet in the community. The environmentalists are trying to promote like a recycle is here, like the bins, use the right bin. Um, all these different professions, their role is to create a community which is thriving and has that information. That's just the way I see it from like a societal zooming out sort of perspective.
Hmm.
Um,
No, I understand. It's like everybody has their place and should stick to their role, but and then everything is balanced, right?
yeah.
Is that more or less what you're trying to say?
Yeah, pretty much. Like if everyone plays their role, like the community will just thrive because we have all
Yeah.
this latest information. We'll live to 100.
So, I'm gonna use a little philosophical argument here, and it's about like how close you are to something. So, wh where do you stop? So, like, let's say somebody directly on the street to you says, like, as you walking by, being like, "Oh, walk with your back straight, or your back will hurt." Right? That's very personal to you and telling you what to do. How would you react to that personally, Victor?
There's a stranger.
Yeah.
I'll be like, what the hell? Like, it's kind of random. Like, I'll be shocked, confused.
Hmm.
Um,
Would you say anything back to them?
will they just keep walking or will they try to like talk to me about it?
Yeah, let's say they're trying to talk to you.
I'll be like, uh, okay. And I'll just straighten my back. I'll just try to leave because I don't want to talk to them.
Cool. And that's kind of my approach of like just leaving them,
Yeah.
right? However, you straighten your back, which sends them a message of, oh, I was right, and I'm gonna go tell more people that now. Like, have you perpetuated a myth?
It was more, I'm trying to get him off my back by following his orders for like that 1 second.
Yeah.
Oh, that's crazy.
So
Because
it's like, no
is
matter
that
what
not
you
what we're
do,
doing?
yeah, somebody's gonna take something in a certain way, right? And it's like, how much do you want to fight? And then after that, do you make sure everybody else in the street also doesn't have that belief?
Yeah,
Yeah, and then after
because
that, do you go on social media and make sure everybody in Sydney doesn't have it? And it's like, how far do you bring it? Like, at what point do you not care? is what I'm trying to ask you.
Yeah. Can we come back to that? Because I took a different point from that point, which
Yeah,
was
yeah, okay.
um when if someone started yelling me, "Oh, straighten your back," right? I'm just like obeying them just so like if they're not some crazy lunatic to like talk to me anymore, right? But like I feel like maybe sometimes we can come across that way of people we tell people something, maybe if we don't do it in the best way, and they sort of say like, oh okay, yeah, yeah, but like they're agreeing, but not they're not fully agreeing. They just want to get us off their back, like in that same situation.
Yeah.
That was kind of like a role shift to me because I've never had that happen to me. That's just something I
Yeah.
noticed. Yeah. Um. So
And that's why challenging can sometimes like come out poorly because it's like not only have you not changed their mind to be more helpful for themselves, but they also don't like you anymore and probably won't listen to you.
exactly. Yeah. 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 And it's like that friend who you say like do you want to make plans and stuff? They say yes, but then they actually like don't really. It's like a yes can mean a bunch of different things.
Yeah, exactly. When it's easier to just be like, "Oh, sorry, man. Like, I'm not about it right now," and then you can understand it, you know?
And coming back to your point, yeah, in that because you made it a lot more personal by putting it in that like you're walking down the street situation. I probably wouldn't even tell anyone. I'll just go on with my day.
Yeah, right. But then at the same time, let's say you're walking by two people having an argument about, like, oh, you should go to the physio because you need to get your spine cracked or whatever. You
I've
know,
been in that situation.
yeah. Would you like want to
Mm.
step in and
I just walked past.
yeah? So it's like so almost the same kind of thing. It's like, are you perpetuating things there? Because it's like you just got to choose what battles you want to fight and make sure that while you're fighting them, you're feeling fulfilled. Honestly,
Yeah.
that's
And
it.
yeah, you're right because going back to burnout, you don't want to why just you're creating unnecessary stress and
Yeah.
the clinic setting will help you in that behavior change, right? If you're
Oh
just
yeah.
in your clothes, it'll be I can imagine it being not as impactful as someone with a belt, with a like proper shirt, everything. That's the context of going to a clinic, the building itself, all these things. You have more authority, and I
Yeah.
think that can help.
I mean, it's all about beliefs, man. It always comes back to beliefs for me. I think one of my favorite things is the fact that I like to dress a bit like a lad and I have my little, Padawan braid and stuff because until I open my mouth, people have a certain,
Yeah,
perspective. Um, I've had it before where people have spoken about health and whatever, and I've been like, oh, it's so interesting, I don't do that, I do X, Y, Z because I find it easier. And then they try and educate me. And
mm-mm.
then I tell them I'm doing a PhD and they quieten down. And
Yeah,
it's like, but hold on, I'm the same person I was 10 seconds ago.
yeah,
Like, what changed here? It's their belief about what I do know and what I don't know, right?
yes,
So they respected me more all of a sudden because I was an authority. And it's like, does a person on the street see as an authority? No. Does a person in your clinic? Probably. you
mm,
know, Stuff like that. Um, there's so many elements to it, man. That's why I would rather just not deal with that. I think even more so with family, because regardless of my profession, regardless of what I'm doing, my uncles and aunties just see me as their nephew. They don't see me as anything else, right?
mm.
And even if they do ask me, they know that I deal with pain. They go, "Oh, my shoulder, Andrew, can you just give me a massage?" I could say to them, "I don't do that. I don't massage." Or I could be like, "No problem. 1 second. Bing, bing, bing." And they go, "Oh, thanks. I feel so good." And I know I did fuck all, but it helped them. So, you know what I mean? So I just like avoid those kind of conversations because they're not helpful.
Okay, yeah, the massage is a good example, but what about if they say, "Oh, I guess okay, if they're saying, "Oh, my back hurts or my shoulder hurts," like what do I do? I guess you would just go for the standard like evidence-based or clinical guidelines at that point, right?
I will give them, yeah, pretty much clinical guidelines, pretty clear cut, simple things, which most people aren't happy with, but that is the easy things. And I explain it to them, but like, look, you're not going to like this simple answer. Um, but this is it. And then I'll be like, honestly though, if you want help, you should see somebody,
Mm-mm.
you know? I think the last thing I want to do is actually have a family member as a client, to be honest, because then that therapeutic effect of the authority isn't there.
Yeah, yeah. Yeah, yeah, that's true. I didn't even think about that. That's actually true.
Yeah, context is a therapeutic effect, man.
Mm. Cool. Okay, yeah, family's kind of straightforward. Like, I guess we went through two examples that makes sense. And then lastly, friends.
Mm,
What would you do? Like non-healthcare professional friends.
yeah. Um, I think I take it all the same way. I think friends probably have more leeway because you choose your friends, right? So they know what you're like anyway. Um, and they'll tell you if you're being too much if they're good friends, you know. So there probably is probably more room there to challenge them directly, you know. Um, I mean, I know my humor can be insensitive sometimes, for instance, like just as an example, and friends have pulled me up on it. And then I go, but it is funny. And they go, yeah, I know it is. Like, you didn't mean it like that, blah, blah, blah. And the same thing can happen with like trying to help them. You can be like, ah, this is this. And they go, yeah, but I don't really care. And you go, oh, sorry, I was just trying to help. Do you know what I mean? So there can be
You can
that
go
little
too
back and
far.
forth.
Is that what
Yeah,
you, yeah.
yeah, yeah. And then it doesn't matter so much. Whereas with strangers and family, it's not the same thing, right? So with
Yeah.
yeah, so like with friends, you can probably just be like, hey, look, like this is my job. Like, listen up, you know.
Mm-hmm. So
Like if
sorry,
yeah,
yeah, continue.
oh, I was just gonna like if a plumber friend or if somebody that's like an architect told me something about my house or whatever, I'd be willing to listen straight away, right? But if
Mm.
a random plumber came up to me, I'd be like, go away, you know?
Yeah, yeah, yeah. And a good point there is like if you overstep or like over lecture with family, it gets awkward.
Yeah,
Um, Especially like imagine a Christmas dinner, you know. It's yeah, yeah, yeah. Um, but with friends, there's either that serious mode or that funny mode where you like you're joking around and stuff. So you just got to sort of feel it out, I guess. So like you can't because you'll know what each person is doing. Like if they're studying something, like you said, they'll listen to you more. Um,
yeah.
Friends are probably do you think you would agree with this statement that friends are probably the easiest to switch their beliefs?
Um, oh, I mean, it's a bit general for me. I think it all depends on who the hell you're talking to. Like as a
Mm.
category, for it to depend, like the compare it from family, friends, and strangers. Yeah, friends is probably the easiest to have a quality convo
What
with and
about
get them to
patience?
understand.
Do you think you find it
That's so
super
variable.
general? Super general.
Yeah, just because like patients will be either really, against it depends, are they there for like work cover, are they there privately, those type of questions, NDIS. Um, there's so much to it.
Mhm. Okay, I guess from all the just from a general context, I think, and just my own experience, I feel like friends might be the easiest, and or least consequential, I guess.
Yeah, that's a good way to put it, I would
Yeah,
say. Yeah.
like if you stuff up, they're still gonna be your friend, and it's you just laugh about it or whatever.
Yeah. And if you stuff up and they are no longer your friend as a result, you kind of think, okay, well, maybe it wasn't a good friendship, things like that.
Yeah, yeah, yeah. Okay.
Yeah.
Uh, do you have any last words that you want to talk about friends before we kind of wrap things up? I think we did pretty well.
Yeah. I mean, I feel like we can just yarn and yarn and yarn, but I think maybe oh, you know what? Talk about yarns. What we didn't talk about is like beliefs around like cultural beliefs, for instance. Right? That's a big one, right?
What do you mean?
So, well, I mean, the difference between an Aboriginal person or my background, a Sicilian person coming to me, I'm going to deal with them completely differently for their pain, right? For the Sicilian, I'm gonna be like, no, you're doing this, you're doing that, listen, blah, 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 right? Because I know that they're gonna want an autocratic person. They want their doctor to tell them what to do and how to do it and when to do it, right? The Aboriginal person, I know I have to deal differently because of the culture difference, right? Um, it'll be a lot more talking about, their mob, where they're from, and things like that. There's an actual like approach that you should utilize with Indigenous people, to be honest, because they believe that like there's certain medicines that are going to be way more helpful than anything you can give them, and that's what I'd want to concentrate on, as opposed to the Sicilian coming to me. I'd be like, yeah, look, a little bit less pasta, a little bit more walking, and your back pain will probably be okay, stuff like that. Like maybe get out in the garden more, and that's just me connecting with my own culture. So then it'll be again different if I was dealing with a white, person from the UK. You know what I mean? I'd probably be a lot
Yeah.
more professional with them and things like that. Yeah,
Interesting. Okay. Culture. That's something that's a like thing I haven't thought about. How culture can play into all these different because I broke it down into categories of like patients, colleagues, public, family, friends, but within all those there's different cultures and stuff like that, and that can really change our beliefs. And
yeah,
do you think it's more about just being aware of their culture, or because you can't really study each culture and like know what to do, is it
yeah.
more about just having it at the back of your head, okay, maybe it'd be better to approach it this way?
Yeah, there's some stuff that you can't know about, right? So, like, if a Muslim woman came to me, I'd immediately ask them if they're more comfortable with another woman, right? Stuff like that. But that's only something I know through having, friends that practice Islam and stuff like that. So, um, there's only stuff that you can learn through experience. Or, yeah, you can do like courses on these things if you've got time and money for it as well. Um, but a lot of it will be guessing and checking for cultures.
Mhm.
Yeah.
Cool. That's a good point to end it on. Just like a whole like bundling up together, like everything we've talked about with culture and
Yeah.
thinking about how we can just have it in the back of our mind and how we can change our even our tone of voice,
Oh yeah.
right? That's
Yeah.
yeah.
Like tradies. You're like when I've got a tradie, well, I'm swearing in session. It's that
Yeah,
simple.
yeah,
Like, you know what I mean? Because I feel
yeah.
more at home.
So it's not even about the words you use, it's also like the approach, the tone. It's like you're almost a different person.
Yeah. Or I mean, all my same behaviors are there, but just the interaction is more for them. It's a bit of theatrics, but
Mm.
yeah, I'm still me in a way.
And like we could talk like a whole other hour of like how you can approach different cultures with different tones and how you would talk. That's like more communication.
Well, because then we can start talking about like culturally and linguistically diverse kind of people as a whole, you know, um, which is a big area.
Or are you talking about how like just Australia, how it's multicultural and there's like so many different cultures that
Uh,
might not just be from one culture?
so if you type up the term CALD, CALD, there's a whole
Yeah.
bunch of research on culturally and linguistically diverse people in healthcare and how to help them in ways that are good for their language, their religion, and their culture and things like that. Um, so like dealing with translators and all that type of stuff. Yeah.
Oh, okay. So culturally, what was
And linguistically diverse.
okay.
So basically, people that are either born in another country or speak a second language at home, things like that.
That must be pretty much like a large majority of Sydney though, surely.
Yeah, so my
Yeah.
grandparents would be called clients if they went to somebody. My mum wouldn't because she speaks English and is born here. My uh, sorry, I forgot the uncle. I was about to say in Italian. My uncle was born over in Sicily, so he'd be called technically, even though he's lived here most of his life. Things like that. Yeah.
Mm. And there's like research on this.
Oh, it's heaps of research.
Oh,
Yeah, yeah,
okay. Okay, okay.
yeah,
Interesting.
yeah, man.
Cool.
There's so many avenues to beliefs and everything, and when not to challenge people. And then actually, here's another one: generations. Having a Gen Z versus having a Gen X or Boomer, right?
Yes.
Yeah,
It's complex
yeah, man.
because you have your relationship to them, which is kind of what we've talked about today. Then you've got culture, which is like how you talk to them and stuff, like their context. And then their generation, it's all a big mess. And then
Yep.
you can see why, like, it's quite easy to stuff up when
Oh
you're talking
yeah.
about these things. Like, yeah. And now the fact that Australia is so multicultural, you got people with completely two, like their parents are completely different backgrounds, two different contexts. It gets crazy. I
Yep.
can imagine.
Yeah, I'm actually like I mean the more categories we can talk about because we can keep going, but the more it's just individualized for that person, you know.
Yeah, and that's what it gets down to at the end of the day.
Yeah, because then we can talk about if somebody's autistic or like,
Oh yeah.
bipolar, schizophrenic, things like that, So like then we can like talk about diagnoses and things as well.
Mhm.
So yeah.
So I guess that's a nice note to end it on. Depends on the person, but you have to consider all these different factors before. Um, and also the main takeaway from today I think I've gotten was the idea of adding a new perspective rather than demolishing the current perspective.
Yeah. I think if we take away anything, it's make a new bubble for somebody, don't pop their current one.
Yeah, yeah. There you go. You're gonna take that.
Yeah, that's a good one, man. See, we learn from each other.
Yeah. All right, cool. But I guess we'll leave it there.
Sweet.
And
Good chat.
yeah, it was great. And I'll see you in the next one.